What is thermography testing? What do you do and what should you expect? What is infrared thermography used for? Can thermography detect inflammation? What do the colours mean in thermography? What can full body thermography detect? What are the benefits of thermography? Is thermography reliable? Is thermography for men? What cancers can thermography detect? How safe is thermography? So many questions from you about thermography. What do you do to get answers? In this second video about thermography testing for health, I'm going to fire more of your questions at Australia's leading thermographer, Pauline Rose, to know what is thermal imaging used for in medicine, and by sitting in on a typical breast scan to see how does thermography work. Pauline, I'm back. What is thermography testing?
It's testing changes in body function, and that is measured mainly by inflammation patterns.
What is infrared thermography used for?
Well, all thermography is infrared thermography, and we're measuring the far infrared tones that is put off by the human body or the animals. There's a lot of thermography used in vet work. They have them in the zoo.
Can thermography detect inflammation?
Yes, it's all about detecting changes in body temperature, inflammation patterns, and also cold patterns.
What do the colours mean in thermography?
Well, on the whole, when you get a lot of green and yellow, they're considered normal. A normal distribution of heat within the body. When you get blue, it's often poor blood flow, there's a constriction for some reason. Sometimes you'll even see that in lungs if there's an infection, like pneumonia. You'd expect that to show, perhaps it's red because it's an infection, but it will show blue because of the poor oxygen levels.
What can full body thermography detect?
Oh, a huge variety of things, from injuries through to poor circulation, reflux. We see a lot of thyroid problems in thermography. We cannot see, it's what we can't see that's interesting. We can't see behind bone, so we don't see the brain, for example, behind the skull, and we don't see behind the pelvic girdle. So it's not a good test for ovaries or prostate.
So would it be wasteful if I didn't need a full body thermogram?
You can choose how many portions of the body you want to have done. Some women just want to have a breast study done.
Is IR and thermal the same?
Yes. Infrared. It's really far infrared, but it's the same.
Pauline, what are the benefits of thermography?
Well, the benefits of thermography are that it's quick, it's not expensive, it's a comfortable test, and it can often give you very early clues that some form of intervention is needed.
Pauline, is thermography reliable?
I'm a little bit biased. Yes, I do think thermography is very reliable over time. We can do a lot of comparison screening. As I said in a previous question, there is nothing that is 100% reliable in any of the screening that are offered.
Is thermography just for women?
No, I think it's predominantly for women because the breast screening has got so well known. But we do see an awful lot of men as well, and even some men with breast cancer. Don't forget that can happen. But probably with most men, we're looking at injuries, we're looking at gut issues. We see quite clearly a lot of stomach problems, reflux, livers that quite frankly have had a bit of a hard time, do come up a lot. And that's probably mostly what we're seeing men for.
Any symptom common to men you've seen that prompted you to advise them to have a thermograph?
Most men come in because their wives have told them to. And it's not that I've told them to come and have it done.
Sounds about right. And what cancers can thermography detect?
It's not about detecting the cancer itself, because we don't diagnose that. It's about detecting warning signs. And then you, with that and the case history from the client, which they all fill in when they come, we're able to make some suggestions of where they can be referred to for a full workup.
Pauline, is anything injected in thermography? Is radiation or X-rays involved? And will anything affect the DNA or future offspring's DNA?
In terms of the safety of having a thermographic image taken, think of it as having a series of photographs taken. There's no radiation. We don't squash you or touch you in any way. There's no contrast injections required. It's just as simple as having a photograph taken.
Therefore, it's absolutely non-invasive.
Non-invasive.
Is there an age limit for thermography?
There isn't an age limit in terms of young. We do see a lot of people that are quite young, particularly if there's been a family history. I think there's an age limit in the older women. We still have women who will come to us in the quite senior years because they're used to us and they're not keen on some of the alternatives. But as I have said in the previous answer, it's sometimes better to have a mammogram in the older age group.
So how young can you have a thermogram?
I've seen children in their late teens. Perhaps they've had some concern. Maybe there's been a high family incident. Maybe they've got sore breasts, which are most likely to be just their hormones. But they will come and let us have a look.
Having said that, let's have a look at a digital infrared thermal imaging or DITI, infrared thermography or IRT, thermal imaging or thermography session, as it's all the same thing. Pauline now has a patient in her room, so let's observe. Thanks, Pauline. Over to you.
This is a very quick test. I'm just going to run through what I want you to do before we start. You're going to be facing different directions so I can get a shot from lots of angles. And you see numbers on the floor, so I'll just tell you what number to face when the time comes. Lovely. Right, well, we'll get ready. This is as close as we come with the camera, so there's no radiation involved here and there's no squashing. But I do need you to put your hands on your head like that. The reason that we put your hands up high like that is we can get to see the lymph glands under your arms. And that's always important when we're doing a breast screen. I also get to see your thyroid, which often changes when women get to middle age as well, and that can be a useful additional finding. Okay, sitting still and facing position 1. If you swing around to number 2 on the floor, perfect. Now number 3, number 4 please, number 5, now number 6 is the back wall, thank you. Now this time you put your hands on your hips. Now I'm going to get you to stand up. It's quite useful to have a look at the abdomen as well, but it shows us the difference between your breast temperature and the rest of the trunk. So if you put your hands out to the side like that, and please face the back wall, we'll do the same thing. Relax. I think you're done.